Picture this. You're recently unemployed due to the effects of the coronavirus. Because your employer supplied your health insurance, you no longer have health care. Furthermore, since you've lost your job, you can't afford to buy any health insurance from a private supplier. You're one disease away from bankruptcy. This is the dilemma millions of Americans are currently facing. If one of them were to get sick in this situation, they'd be facing thousands of dollars in medical bills and bankruptcy, plus the added stress really wouldn't be good for their health. In other developed countries, they use a single payer system where the government covers the cost of health insurance and covers everybody. So I'm a political science major, still an undergrad, but I have a little bit more of an understanding to talk about the terminology used to be able to break all this down for you. Furthermore, due to the research I conducted for the speech, I've become more educated on the issue itself, which has led me to conclude that single payer is superior to the American system of private insurance because it covers every American and it lowers the cost of insurance. We should hold our elected representatives accountable and pressure them to become in favor in the implementation of a single payer system. First, I'll examine the problems that come with the lack of universal healthcare coverage and how a single payer system would fix it. Then I'll explain why a single payer system is cheaper than the private American system. Finally, I'll reiterate why this issue is of the utmost importance during a crisis like the coronavirus. To begin, let's get some definitions out of the way. The American system of health insurance is run by privately owned insurance companies that are either provided by companies themselves or provided to employers who then provide it to the employees, which is about under half of Americans get it that way. A single payer system is one where the government pays for universal insurance coverage with tax money. Now that we've got that out of the way, let's get back to the scenario I laid out earlier. Millions of people receive their health insurance from their employers, meaning if somebody wanted to quit their job or was laid off, they'd be without health insurance. This gives tremendous power to employers. Basically, work for us or you won't have health care. A single payer system, being universal, would not only cover those who were laid off, but would emancipate others to be able to pursue interests instead of working for their benefits. This encourages risk-taking and innovation, which are necessary qualities to have a strong and competitive economy. So, what about the people who aren't covered? According to researchers of a 2019 study in the American Journal of Public Health, 530,000 families per year go bankrupt due to medical bills they can't pay, constituting about 66.5% of all bankruptcies. Many of them are forced to use online methods of raising money like GoFundMe, but it doesn't always work out. Worse yet, according to a study conducted by the New England Journal of Medicine, there are about 60,000 preventable deaths per year caused by a lack of insurance. How can a medical system be deemed functional when it leaves tens of thousands of dead and even more financially destitute? These results truly speak for themselves. Under a single payer system, everyone is covered and the medical care is free at the point of service. The money comes from taxes. Now you're probably asking, how does paying through taxes make it cheaper? Well, due to it being a public system, there's no profit earned from the selling of insurance. This also means there's no advertising budget or any other sort of overhead cost needed to compete with other insurance companies, since the government is the only supplier of insurance. Furthermore, since everyone is covered, there is a more diversified risk pool, which overall lowers the cost. According to a 2018 Mercatus Center study, a single payer system would save the United States $2 trillion over a 10-year period. With the progressively increasing cost of healthcare year after year, that's pretty huge. Yes, your taxes go up significantly, but you net save money. All of these statistics, though, were the U.S. before the coronavirus. It's not that surprising to me that we have the highest rate of infection and the most deaths in the world because the current system set us up for failure. A 2018 Forbes poll suggests that 44% of Americans skip doctor's visits due to the cost. The uninsured are avoiding hospitals and they're dying at home. Another survey, this one a 2017 survey of the healthcare systems of 11 developed countries conducted by the Commonwealth Fund, found the U.S. healthcare system to be the most expensive and the worst performing in terms of healthcare access, efficiency, and equity out of the 11 total. Essentially, it costs the most and it gives you the least. Thousands die, and even more go bankrupt due to the lack of coverage. This is why you should support candidates that advocate for a single-payer system. With the virus tearing through our country, the illustration for its need has never become more apparent.